Hi, my name is Rachel and I work for relink.org. Thank you so much for joining us today for our Recovering Housing webinar. We're going to take just a few minutes to let people come on and join, and then I'm going to share a little bit about Relink and what we do, and then I'm going to turn it over to Reba, and she's going to give us some great information today on what the work she does in recovery housing. Great, we're going to go ahead and get started. So today we are going to have our presentation on recovery housing. Reba McCray is going to give that presentation, and she's going to share a little bit with you about the work she does and introduce herself when it's her turn for presenting. But I just wanted to tell you a little bit about Relink. So relink.org is a free database in the state of Ohio. We are free to use and free to be listed on. We have over 16,000 resources. So we have resources in several different categories. We try to keep all of the resources for anyone who is in need in one central spot. Sometimes I say it's just like a giant phone book of resources throughout the state of Ohio where you can easily access a resource. We say 30 seconds and 3 clicks, you should be able to have a resource. So we tried to make it as user-friendly as possible. When you go to relink.org, you're going to see this option to click on Find Help Now. And when you click on that, you're going to be able to see these different options on the left-hand side over here where you can put your city, your zip code, how many miles you want to search by, 10 miles, 25 miles, 50 miles. There's also an option to select by county. We are on all the tablets in the prisons throughout the state of Ohio, and that's how they search is by county. So typically we have around 2,000 users per week from the general public and a little over 2,000 users per week that use us on their tablets, relink.org, in the prisons. So as you can see, one of the selections that you can pick is addiction recovery. We have several different categories: reentry, human trafficking, family services, emergency and crisis, behavioral health, which is counseling, basic needs. And when you select addiction recovery, you can click on housing. And I'm showing this for example's sake today because that's what we're going to be talking about. And then you can click into housing and see the different types of housing options. There's hotlines, the different peer recovery housing, and that's what one way that you can access the different resources and find lists of those different recovery houses by easily clicking through Relink. If you are a provider and you're not listed on Relink, you're going to want to contact us at info@relink.org. Kathleen does our data and keeps it up to date, and she makes sure that our provider information is correct. She'd love to connect with you and show you how you can get your services listed on Relink. If you already are on Relink, but you were looking over some of your information, this is a great time of year to audit your data and look at your information, how it is presented on Relink, see if it looks correct. If there's anything that you need to change, you can easily create a provider login. Up on the top right-hand corner, it'll give you an option to click on that. Provider login sign up. When you click on that, you put in your name, your email address, and it will give you access to whatever organization and provider that you work for, so you can quickly edit the data. And Kathleen will connect the two just to make sure that you for sure work there and you have those privileges to edit the data. But then we don't do anything with that information with your email or anything. It's just strictly so that you're connected to edit data. We don't sell email addresses or do anything like that with the information, but it's one easy way that you can go in and update your data. We're always happy to help too here at Relink. So if you have any questions, you can always reach out, info@relink.org. One thing we've really been working really hard this year on is getting the different organizations to update their bed capacity. So if you are a provider that has beds, there's simple ways that you can just go in. It doesn't even take a minute per week and update how many beds you have available. It definitely will draw the eye of whoever is looking for a resource to see a green little bed lit up next to your provider information. It'll show them quickly and simply that you do have beds open. If it's red, that would mean that you don't have beds open. And if it's gray, it means that data hasn't been updated, that information within the last week. So if you have beds, I highly encourage you to update that. It's only going to help people be able to find you and quickly see that you have beds available. This is all of our information at relink.org. If you need to get a hold of us, you can call us, you can email us. We're always happy to answer any questions you have or help you with any data, or if you're trying to figure out something specific to maybe another organization or you need help, you can always ask us. We try to not only have our database of free resources to help people within the community connect, but we try to connect each other collaboratively as well. So thank you so much for the time that you took to listen about Relink. And I am going to stop sharing and I am going to turn it over to Reba. She's going to share, she has a presentation that she's going to give, and then we are going to take questions at the end. It might go a little over an hour past 2 o'clock. So if you have to hop off, feel free to, but otherwise we'll try to get those questions answered so that you'll have that information that you need at the end. All right.
Thank you, Rachel. Hello, everyone. Nice to be joining you today. We just want to say it's such an honor and a privilege to be here and to be able to present on something that I'm very passionate about, which is recovery housing. So I'm going to share my screen so I can bring up our presentation. Nice to see that we have people from all over the state of Ohio. So welcome, welcome. I don't know how it is where you are, but here it's cold and snowy, just in time for Christmas. So let me pull up my screen. We are presenting on there we go. Here we are. So I'm presenting on certified recovery housing for the state of Ohio. Always an honor and a privilege to talk to everyone and to offer information and resources on what recovery housing is, what it should look like when you're utilizing it for yourself or the people that you work with. So this should give you some good information as we move along. The definition of recovery housing, according to the Ohio Revised Code, just says recovery housing means housing for individuals recovering from drug addiction that provides an alcohol and drug-free living environment, peer support assistance with obtaining drug addiction services and other drug addiction assistance. So I like to bring this one up just so you know like what it says in our state. And then I'm going to tell you what the National Alliance of Recovery Residences suggests, because this is our national alliance, and it's the alliance and guidelines and assurances that we follow at Ohio Recovery Housing for the state. So the National Alliance of Recovery Residences defines recovery housing as safe, sober, and healthy living environment dedicated to promoting recovery from alcohol, drugs, and other associated problems. So I'd like to start off with just a couple of definitions and then just to kind of tell you what recovery housing should be offering people and what they should be receiving while they're there. So they should be offered a place that's safe and has sobriety recovery happening in the home. One of the things that's going to happen while they're there is it should help improve individual health, physically, emotionally, relationally, and spiritually. They should have get involved in positive community involvement, so like with work or school, volunteer organizations, and most definitely recovery communities. We also want them being connected to treatment centers or other recovery supports that are going to help them along their journey. And like Rachel mentioned, that we will take questions at the end. So if you have them, just kind of hold on to them and we'll get to them. I want to define what the social model of recovery housing is, because this is the basis of what the standard is for the recovery housing model in the state of Ohio. The social model of recovery housing is a recovery-oriented chronic care approach to substance use disorders in a home-like setting. The philosophy and practices used in the home are different than medical clinical-based treatment models. This emphasizes social and interpersonal aspects of recovery, using recovery as the common bond. The social model values experiential knowledge, mutual support, and views recovery as person-driven, lifelong, and a holistic approach process leading to long-term recovery. So this is the basis of what the home should feel like and look like when you're choosing your recovery house. So some of the things that we are always looking for is going to be the physical environment. How does it feel? What does it look like? Is it recovery oriented? Are you building resident relationships? How do you handle conflict in the home? Are you building community supports and resources within your community? And then we're going to talk about governance, which is one of the main reasons that we're doing this right now, is because some things are changing with the law and with the state of Ohio. And we want everyone to be aware of what's happening. So the National Alliance of Recovery Residences has established 4 levels of recovery housing. Rachel went over it a little bit on her introduction, but it just offers different levels of support for residences, rather than serving kind of as a linear step down continuum model. It meets varying needs of people at varying stages of recovery. So people can move in and out of the different levels just depending on their circumstances. Now, it can be like a step down. You go from a level 3 to a level 2, but some people are at different stages even when they enter recovery. So the models are set up to meet everybody no matter where they're at. So here's the levels. I like to go over them. Peer run is a level 1, and that is meant for people with at least 6 months or more of abstinence of long-term recovery. And it is more peer run. It's exactly what it says. So the people in the home really run the home. So they're just kind of making sure they're all doing what they need to be doing. They're all going to meetings. They're all being accountable to each other. Usually you'll have a staff or the person who is in charge of the home or runs the home will stop by maybe once a week or once a month, make sure everything is good. If they need anything, they're there. But this is really more of an independent run house, and somebody who is pretty strong in their recovery, has lots of recovery capital. This is going to be their level. Level 2 is peer monitored, which means the peers are helping also run the house and maintain that atmosphere, but they do have staff in the home every single day. And there is some accountability and some governance with this, and we'll talk about that here in a minute. And then level 3 is completely staff supervised. So if you're in a level 3 home, you have staff present 24 hours a day, 7 days a week. This level is more for people who are brand new to recovery. Maybe they could be just one day clean and sober, but they're going to need a lot more support and care. So you want to make sure that you have staff 24/7 to help assist with them in that level and offer the support that they're going to need. Level 4 is actually residential treatment, and we do not have any of those in Ohio, so we're not going to talk about that today. So let me go back to some of the things that I told you the house needs to be certified to be a recovery house in the state of Ohio. So we're going to look at your physical environment. To what degree does it feel like a home? Is it architecturally sound? So what I'm saying is, there's no holes in the wall. There's no holes in the floor. The steps are solid. There's no broken down car outside. We want it to look like a home. We want it to feel like a home. We want it to be functional like a home. So you have bedrooms, you have kitchens, you have living room, you have a dining room, you have spaces for people to gather and get together. So it's home-like. There's a community space for gatherings, and then it does feel very welcoming. So this is the kind of things that we're looking for. Again, we want it to be recovery oriented, so we're looking for the atmosphere of the home to be centered on recovery, utilizing that experiential knowledge, which just means people with lived experience are part of your volunteer and staff. The language that you're using should be recovery oriented. We're going to talk about substance use disorder or people in long-term recovery, or if they've had a return to use. We're not going to talk about shooting dope and getting drunk and I'm just a drunk or a junkie. we want to use recovery-oriented language. We want to have a recovery language in the home, like, recovery phrases, and do you have pamphlets for meetings and things like that. So it should be recovery-oriented. Some of the things we're going to do in the home is we're promoting relationships. This is very challenging for some of our newer people coming in. Addiction is the disease of isolation, so we want to learn how to promote relationships. So we start with our staff. So most of our staff are going to be alumni, people who've been through the program, or people who actually are in recovery themselves as well. So these key roles don't require professional credentials. They can just be people with the experiential knowledge or lived experience. We also want mutual aid, peer-to-peer encouragement. So we have a structure, usually some kind of setup where there's either like a senior resident or a buddy system, just so you have somebody to help the others, like to encourage them, to help them be accountable, and to oversee the house. This is where certification comes in. You want peer supporters, and they do need to be certified by the state. So you want peer support specialists in your home to help navigate some of the challenges and barriers that some of your people are going to come in with. Learning how to work through some of these systems, like getting an ID and getting a driver's license, and navigating probation or parole, things like that. How to go through children's services and learning how to work with a caseworker there, and how to get support for you and your children. So peer supporters are going to help you with all of those things. For us, one of the main things that peer supporters help our residents with is recovery plans. All homes that are certified in the state of Ohio work recovery plans with their residents. And recovery plans are simply really plans that what they want to do with their life. What do you want to accomplish while you're here in the home? What goals are you working on? And then even what do you want to do after you're no longer here in the home? So we want to have recovery plans. And our recovery plans usually also, again, are going to deal with the whole person. So we're going to ask you to do things like, go see your primary care doctor, make sure you're physically well. We're probably going to talk about, I'll get to this too later, some life skill things, but then just what are your goals and plans? Where do you want to go? Where do you see yourself? What would you like to be doing? What is your career path? So these recovery plans are really very resident driven or client driven, you might say, and then it's empowering to them because these are their goals. This is their plan, and where do they want to go from here? Some of the things that are happening in the house, again, back to relationship skill building. Again, this substance use disorder or the disease of addiction is a disease of isolation. So helping people learn how to reach out for help. It can be very challenging because many of them haven't asked for help in a really long time. It's, can be viewed as a sign of weakness. So reaching out for help. So learning to get a sponsor or a mentor. I want you to start building your recovery community, your tribe, so to speak. Who's going to go with you after you leave here? The people who are going to be in your life long term. So we're asking you to kind of reach out to people, to have somebody who's going to be with you, who's kind of for you. We also do weekend social activities, pizza parties, go bowling. Here at ARC Recovery Services, which is where I work, we do a lot of activities. We just did like a chili cook-off over in our building. We did what's called like an ARC After Dark, which is like an open karaoke night. We want to do these kinds of things because they are building pro-social relationships, helping people in our homes find other people to support them and encourage them that are going to be there for them. We're also trying to build a community for them, again, helping to empower them, helping to strengthen their identity. Again, building this community and pro-social relationships are huge. Then again, we're going to help the residents like look out for each other and encourage each other and support each other. And this is kind of what the social model is really built on, is helping each other stay safe and feel supported. After we have people in our home for a couple of months and they get used to this atmosphere, they really are very protective of the atmosphere. And they don't like if somebody comes in and is not following the rules or isn't maintaining abstinence, because it's scary for them. And they really will let us know when something isn't right in the house. And this is all because of that social model that the home is built upon. So we also are going to help with life skill development, which is critical to ongoing long-term recovery. So we want things like employment and productivity. I always say that I love the term that Goodwill uses now, that they believe in the power of work. I believe in the power of work. I think it's self-esteem building. I think it helps people to feel good about themselves and proud. So we always want to make sure that we're helping people with employment or productivity. So it doesn't even have to be, so we have some people who might be on disability and they don't work, they can't work all the time, but we're going to ask them to do volunteer work, or if people want to go back to school. This is a good opportunity to take advantage of that, and we want to help you do that. But then even learning just how to kind of go and do something every day, to get up, take care of yourself, get to where you're going, get there on time, learning to be productive and accountable. Money management, as I'm sure many of you probably know, is a huge hurdle or boundary for many of our people. So we want to help them learn how to budget, not feel overwhelmed and frustrated. Same with time management. So we have structure throughout the day in our programs to help them learn how to manage their time. Like, I have this to do today, which means I can't put it off till tomorrow. So I want to get it done today. House chores, they have treatment commitments, medical appointments, court dates, probation responsibilities, recovery meetings, and I don't even have family time in there or fun. So all of these things, learning how to manage your time so that they don't feel so out of control or unmanageable, to learn how to feel like they're in charge and in control of their day. And then service work. I feel like service work is really one of the keys to some of the things that we do, especially at ARC, is learning how to give back now for the greater good, learning how to give back just because. I say that for those of us in long-term recovery, I wreaked a lot of havoc back there, and now I just want to learn how to give out good into the community and into the environment. Again, it's very self-esteem and self-esteem boosting to do that, to just put good out there in the world today. And then again, back to handling conflict that I talked about at the very beginning, putting all these people together in a house who don't have a lot of the skills that are needed to maintain life and relationships. So we have to learn how to handle conflicts. You know, who ate my Cheerios and they didn't do their chore, things like that. So we want to learn how to handle them in a healthy manner and in a supportive way that's going to help them meet their need and then also bring up what they need to talk about. So we have, like I said, we have a senior resident position, somebody who's going to kind of take the lead of the home and then kind of help oversee and encourage the others and the newer people in the home. We also have house meetings. So we on level 2 and level 3 have weekly house meetings. Now these are mandatory and all the residents have to attend. And we're going to go over the week and see, how are you doing? What do you need help with? How can I support you? Give some congratulations for people who accomplished some of their goals. We have people who, you know, maybe got their driver's license or maybe got to see their son. So we also want to be able to celebrate and support those, along with learning how to talk about needs and bring up conflicts, and just learning how to build relationships in a healthy way and empower each other. So we want to make sure we have accountability. We're also building community. The recovery house should already have some of these in place to help with the residents building up their community. So we want to make sure they're staying connected. We want to reunite with families. Here at ARC Recovery Services, we say we're in the business of saving lives and reuniting families. It's one of the main things that we do. It's very vital and very important for people who are coming in. It's usually one of their main goals is to be a mom again, or be a dad, or to get back with their mom or their dad. So we want to make sure that we're staying connected and have resources available to help with that. We also want to know about the recovery community in our area and what's available to our residents, what kind of meetings, what kind of 12-step meetings, is there smart recovery, AA, NA, where are the recovery community organizations? Like, we're in Akron, so we have 2 right now really good recovery community organizations where they like have meetings and they have parties and gatherings and get-togethers and things for people in recovery to do. And then also just getting involved, having civic involvement and taking some pride in your own community and in our community, like here in Akron. What are some things we can do to become a part of that and help make our whole city better? So you'd think that's a lot for recovery housing, and it is, but it's all good. You want your recovery house to also be connected to some of the support systems, recovery support systems, again, that your residents are going to need. So who are your treatment providers in your area? Do you have good relationships with them? Know about your criminal justice system. Do you know who your judges are who are working with your residents? Do you know where probation is and parole and how to contact them and communicate with them effectively? Counseling agencies, our people come with lots of challenges. Many have also mental health challenges as well. So how can we best serve them, get them hooked up, get them the things that they need that are going to help them and support them in their long-term recovery. So we want to know things like, who does good grief counseling, who does like some trauma therapy, some things like that. Then just again, your mental health agencies. And I already mentioned your recovery community. So you want to be involved in your recovery community, know what's out there, and know that people that in your recovery community that you can bring in for the sponsorship, for mentors, who is willing to do that and who could best serve your people. Okay, so one of the main reasons we're doing this today is because of governance. So recovery housing in the state of Ohio has not had governance by the state ever. And I'm going to read this to you just because I think it's important. So I want you to see it. So starting January 21st, Ohio will be implementing new requirements requiring all recovery homes that receive funding, referrals, or advertise that they are recovering residences to achieve certification. So according to the Ohio Revised Code 5119.394, the Department of Mental Health and Addiction Services will establish and maintain a registry now of recovery housing residences that meet the criteria that are described in the Ohio Revised Code. No person or government entity shall operate a recovery housing residence unless either of the following rules apply. So it would either be deemed accredited by the Ohio Department of Mental Health and Addiction Services. It would either be certified by Ohio Recovery Housing or it would be an Oxford House. So this is all the things that the state is now going to be looking for. So at ORH, the person who is the certifying entity in Ohio is an affiliate of NAR connected to the nation's foremost recovery housing researchers and practitioners. Our staff and volunteers have demonstrated the ability to provide training, technical assistance, quality reviews, technology to support anyone who would like to become a certified recovery house. We want to make sure that quality housing is being offered, that there's a low barrier to becoming certified, and that all people who are recovering from a substance use disorder have the ability and the opportunity to stay in a certified recovery housing. So people recovering from substance use disorder do have significant challenges. Many of you already know that. So we've created a standard of quality housing that includes measures and assurances that benefit the house and the resident. There should be basic policies such as client rights, fair housing rights, a grievance policy, medication policy, drug screen policies, to name a few. We're also going to ensure that we have a good neighbor policy. So we want to be a good neighbor in the communities where we are residing. We want to have standards that adhere across the state so that all the homes that you walk into should feel pretty much the same. The programs will vary from home to home. We like to say we're kind of the blueprint of the house, the framework, if you will, and you can tailor it and decorate it any way that you like, as long as it meets these standards. We believe that all people deserve to have a warm, safe home that supports them in their recovery journey. So we just want to say, as I get ready to close this webinar, that the social model of recovery housing, here's what you get. This is why this is important for the continuum of care for people. It decreases substance use. This is evidence-based, reduces recidivism, increases income, increases family and social functioning, improves psychological, emotional well-being, and increases quality of life. So research indicates that the longer a person remains in a recovery environment, the greater chance of long-term sobriety and increased financial well-being and overall stability. So we all want that. So we want to support certified Ohio recovery housing. Again, my name is Reba. I am the Executive Director of ARC Recovery Services. And it's just been a joy to make this presentation for you guys. Let me see if I can click out of here for you so we can end this. And then we'll go back to Rachel.
Yeah.
And then if you guys have questions, I don't know how much time we have left, but I tried to get through it quickly. It's a lot of information. So good thing I had a PowerPoint because otherwise it's just me talking. But if there are questions, we'll do questions now.
So, I did have one question. Can the PowerPoint, slides be shared, or did you want to keep those?
We can share them. In fact,
Mhm.
I think I sent them to you, Rachel, and
Ah,
you can share them if you like. Absolutely.
okay, so
Absolutely.
tomorrow we always do like a follow-up email, and then I'll include that PowerPoint slide in there, so I'll be happy to connect with
Absolutely. It
people
has a
that,
lot of good information in it, so
yeah,
yes.
about the PowerPoint. Is there
Oh
anyone
yeah, I
else?
see some people are asking they would like the slides. Yes.
Yeah, yeah, they were good and they looked really nice too. Let's see, what will happen to the existing recovery houses? Will they be proactively targeted for certification review and possible and I guess it would be possible closure?
So that's an excellent question. So this law actually went into effect July of 2023. So we've given people all of this time until January 1st of 2025 to say, this is coming, here's what you need to be doing, here's the deadline. So people, we won't, nobody's going to close anybody's houses. You just would need to have certification. What I like to say is people can be in the process of certification. If you're wondering, is a house in the process, you can call actually Ohio Recovery Housing, go on their website. They will let you know if somebody is in process and like where they are in the process. Because usually if people are in the process, that means they're working, they're trying to offer the best quality housing that they can. We're working with them. We do almost everything that we can to make sure that people get certified. Our goal is for everyone that wants to be certified to be certified. There's no reason you wouldn't be. I just let people know also, we have standards. So you have 6 people in your home, 1 refrigerator. We have a grant that you could apply for to get an extra refrigerator because after 5 people, the standard is you need another refrigerator. Or if you need new windows, we have a grant again that will help you get up to par to meet the standards. But we just want to make sure everybody has quality housing. And if that is your goal to offer recovery housing, we want to make sure that we have that. We'll even give you a coach or a mentor, somebody else who does recovery housing to help you along the way. We'll send you templates on what do you need for your client rights? What do you need for your, good neighbor policy? We'll send you a template. You can tailor it for yourself. But then just to make sure, like I said, that the standard is the same for everybody across the board. What happens if they just refuse to be certified? Hopefully we just all stop referring people to them. And I don't know what the attorney general will do. We haven't got that far. We just now are getting to the point where people are supposed to have the certification. So yeah,
I think it's great to know that those grants are available as well
yeah.
for some of these. If a program is OMAS and CARF accredited, do they still need ORH certification?
Okay, here's the thing. If you have OMAS doesn't do housing. It doesn't certify housing. I know that it says that, but they don't. They've given it to ORH. CARF accreditation is accepted until the next go around. So if you have CARF accreditation and it's good for another 2 years, you're fine. But at the end of that 2 years, you will have to be ORH or Oxford House. Because CARF accreditation, even though they do a great job with their treatment centers, their accreditation for housing, they don't even go to the house. So the state said no, that they won't be accepted. You can keep it until then, you know what I mean? They're not going to make you do it now since you already have it. But once your certification expires, you would need to have ORH certification or become an Oxford House. So yeah.
Is this for free recovery housing and or pay to stay sober housing?
What was the question?
Is this for free recovery housing and or pay to stay sober housing?
So I'm not sure what you mean. Um,
That was
so
Jennifer. If you could clarify, maybe
yeah, if
Jennifer.
you want
That'd
to
be great.
clarify, nobody's paying me. I have to apply for funding and grants and all of those things right now. There's no insurance that pays for it. It's either self-pay or you find ways to get your housing funded, if that's what you're meaning. So.
I'm wondering if she's saying pay to stay as in the actual person you serve is paying.
Yeah, so right. So we have
Yeah.
people who pay that,
Uh,
we have a fee that we charge after a certain amount of time, that you're working and everything. I'm going to expect you to start paying for your housing. And we keep it nominal. It's very small. only because I need you to save money and get out. I need you to get your own place. And if I'm taking all your money, you're not going to be able to do that. But I still got to pay the water bill as well. You know what I mean? So yeah, yeah.
Where can they access those grants you are speaking of? That's a question.
So usually once you're certified, there's some state grants you can look up. You can always go to your, what's called your alcohol and drug board, your mental health board. A lot of times they will offer funding for housing that's certified. So that we
What
get
is
some from our Adams grant. We get some funding from the state. I apply for grants from other organizations and foundations, things like that.
what is the difference between OMAS accreditation and ORH certification?
So OMAS is the Ohio Mental Health Addiction Board. It's the state agency that answers to our state for all our mental health, substance use disorder, treatment services. All of them have to be accredited by OMAS, and OMAS oversees all of them. ORH is Ohio Recovery Housing Association, and we oversee all the recovery housing in the state that would like to be certified, and we help to make sure they're maintaining that certification. So yeah.
What about the houses that are transitional living, but recovery is required? Are those also required to be certified?
Okay, so that somebody got into the sticky area. That's the sticky area. Because there's not a definition for transitional housing. And so I'm not sure what the state is going to want to do about that for those that are called transitional housing, because the funny thing is, like years ago, even our agency was called transitional housing. We then switched over to recovery housing because that's truly what we are. According to those definitions that I just read to you, if those are your definitions, you're recovery housing and not transitional housing. So anybody whose main purpose is to house people with substance use disorder, you're recovery housing.
Okay.
So, yeah.
And then I think this was back to what we were trying to figure out about the paying. It says, I think they mean Medicaid covering housing and being given free housing instead of paying, or grant funding that covers rent for some homes and residents.
Medicaid does not pay for recovery housing. It
Okay.
doesn't really pay for housing. A lot of times what is happening in our state, which is a challenge, is a lot of treatment centers are offering services to people, and they will have a house and put people in it and pay for their stay there while they're doing treatment with them, which I believe is illegal. Because then what if that person doesn't want to have treatment there? Now it affects their housing. So that's why we're trying to establish that you have to be certified recovery housing, which applies all of the client rights, their right to choose treatment. There has to be a process to ask them to move or leave, because a lot of these places are saying you can stay here while you're in treatment, but then you're going to have to find a place to go. And to me, if you want to do residential, just do residential treatment. It's a whole headache, but yeah.
Does the facility considered class 2 need to be ORH certified as well?
So if you're a residential, no. If it's residential, or if you're residential, then no, you don't need to be ORH certified. Unless you're housing with substance use disorder and you're a house, then yes, you would need to be certified.
What if it is not residential?
So what does she mean by, or yeah, what do they mean by, I don't know what they mean by class 2 then.
Okay, then we went into bottom line, ORH certification allow you to access funding through the state ADM board, ? Otherwise you can get funding through ACF and other smaller foundations.
It opens a door for you. It doesn't mean you're actually always going to get it, but it means now that you have a better leg to stand on. And they're saying, according to the state, you can't receive any state dollars or county dollars if you are not certified. So your ADM board wouldn't be able to fund you if you're not certified. So you'd want to be certified so that you can even approach them for that funding. And you're right, like the SOARS grant, things like that, you're not going to get it if you're not certified. They want you to be certified, because we're saying, here's the standard. They're saying, okay, you already meet those standards. We know that you're safe. Your residents are in good shape. They have people to call if there's problems. We can now trust you and offer you funding for your people. So yeah. And ACF, yeah, is another foundation actually, yes, to help with offset costs. Yeah.
Do we
absolutely.
have any Oxford houses in Ohio?
We do have Oxford houses in Ohio. They are actually up and coming. I think they just opened an Oxford house in Akron. I only have a little bit of information about Oxford House, so I'm not the expert to ask. What I will tell you about Oxford House, from what I understand, it's really a level 1 run home. So the peers run it. They should have good, solid recovery to be able to maintain that. And then the Oxford House is really like a franchise, from what I understand. So here's what I say. It's like Pizza Hut. If you want to run a Pizza Hut, you can run a Pizza Hut, but you're going to run the Pizza Hut the way Pizza Hut says to run it. And so that's kind of like the Oxford House model. They have lots of stats and evidence to show that they're very successful. So, but that is an option. Like I couldn't have ARC, I would have to be Oxford House if I went that route. So, yeah.
Someone said that we do have 39 Oxford homes in Ohio. Will certification determine funding? And
Yes.
you did answer that with the,
Yeah.
will the certifying authorities conduct regular site visits of the homes once certified?
So what does it say again? Regular site visits?
Yeah, well, the certifying authorities conduct regular site visits on
So
the,
what happens is once you're in process, then there is a site visit, and then once that's approved, you're certified. So that happens every 2 years. Now there can be random site visits, or there can be visits that they'll let you know about if there's like a grievance or challenges with your home, or the county has called ORH, then they would probably come out and make a site visit. But usually no. Usually no. Once you're certified, they don't come till for 2 more years usually. Like I said, they will do a random once in a while, but you could go 2 years and never see them. So, and then I see the one about stating my opinion about treatment facilities assisting in housing being illegal. They call it kickback. Just saying. Yeah.
Do houses typically need to register as rental homes with their local community? Are there any certificates or a license a category 2 home would need? Or a license a category 2 home would need?
Okay, I think maybe they're referring to group home. And so here's our challenge in the state. Every county has different zoning codes and different zoning requirements. So you would always want to check with your county. And then even when you're in certification, we ask, you're going to send us something like from your fire chief. Do you know what I mean? That says this is what's allowed in your county and that you meet these requirements. But there's like, for us anyway, there's not a place to register as a landlord for any of our landlords. There's no place to register as that. But like I said, every county is different. So this has been some of our challenges with people in housing. Like some people can do it in this county. This is what's allowed here. And then this is what's allowed there. And that's a whole another bag of problems. So just as best as we can, we try to adhere to local governments, zoning requirements, and those kinds of things. So I think the level 2 is like what you're talking about, is like a group home status. And we tell the state, and we're trying to get unity with the zoning codes to say that we're not a group home, so that's not our status, and trying to get into the Ohio Revised Code for what we are and what we do. So, yeah.
Thank you so much. I don't see any other questions, but if anything comes up and anyone thinks of anything, if you want to email us at info@relink.org. Reba is a friend of ours. We work together a lot, so I can always shoot it over to her and ask her if there's any questions that come up, or if you need any additional information. I'm happy to do that. We will send out the email tomorrow, the follow-up email with the recording in it, and also the slideshow presentation. Thank you for sharing that, Reba. Sometimes I know people don't want to do that, but for their own reasons, but I
Oh, yeah,
appreciate
no,
you
you
doing
have
that.
it.
And
Have
we
at
have,
it.
thanks, Reba, great information. Thank you so much for
Yeah.
your
Thank
time
you
and
for
what you
having me.
shared
Thank you
with
for
us.
listening, guys. Thank you.
Yeah. If you,
And
oh,
it's a lot of
fantastic.
information, but
Yeah,
yeah,
we have a lot of, it was fantastic. Appreciate you. Thank you.
yeah.
So I appreciate your time. I know you were talking about all of the amazing things you guys are doing over at ARC this week and next week for Christmas coming up, and I just appreciate you taking the time to spend with us today and sharing and educating us and giving us more information. Thank you to everyone who
Absolutely. It's a joy
joined.
and an honor. So thank you so much. Thank
I
you.
appreciate you. We have lots of thank you and lots of great
Lots of
information.
thank yous. You guys all have happy holidays, and for us, Merry Christmas.
Yeah.
Thank you so
Have a
much.
great day. Bye-bye.
Bye.